and good afternoon. It is Friday, and that means it is our Lunch and Learn Day. Now, today we're going to be talking about fibromyalgia. Now, fibromyalgia is a very difficult disease because it doesn't have a blood test. It doesn't have any kind of diagnostic criteria. What it is a label that medical professionals have put on a group of symptoms that are self-reported by the patient. So what does that mean? That means I go to the doctor and I say, I think I have fibromyalgia because I hurt everywhere, I hurt all the time, I've got all this sensitivity and that kind of thing. And so what we're going to be talking about is what to do if this is you, all right? We don't want you to have fibromyalgia. We don't want anybody to have fibromyalgia. A lot of the times, we have a practice. We have a holistic healthcare practice. And what we see all the time is that people are not absorbing their nutrition. And so when you are not absorbing your nutrition or you're putting things into your body that are not nutritious, then you're not going to have what you need. So for example, say I have a Porsche, right? I'm going to get premium gas. I'm going to make sure it goes to the dealership and have a tune-up all the times that it needs to. And my Porsche is going to do perfectly. However, if I decide, I think milk will be a good fuel for the car, and I'm going to put milk in it instead of the premium gasoline, then what's going to happen? It's going to gum up my engine. My engine's not going to work correctly. Now, is there anything wrong with the engine? Not necessarily. It just has had the wrong fuel put in there, and it isn't going to work because it doesn't have the correct fuel. Same thing with you in your body. If you are not getting the right nutrition, then you're going to have some problems. So I want to, and I've shown you this before, but I want to show you this again because I think it is so important. This is let me just cover the name here for privacy's sake. This is a lady that we saw today, and she is in the blue. Blue is good. Most people that come to see me, they are in the red and in the orange. So what does that mean? That means they're not getting the right fuel in their body. This is a 20-second test. It's easy. It's painless. All we do is we aim a laser at the heel of your hand to find out what your nutrition is doing for you. What we find 100% of the time is that people come in with sickness and disease. They are not absorbing their nutrition. So just like my Porsche, if I put, milk in the gas tank, I'm not going to get the desired results. Same thing with you, same thing with me. If we put things in our body that are not food, are not quality foods, then we're not going to get the results that we need. So fibromyalgia, all kinds of diseases, chronic fatigue syndrome, lupus, thyroid disorders, autoimmune disease of any kind, all start in the gut with nutrition. And we have seen time after time after time after time that when you get the gut and the brain reconnected, all of your symptoms just go away. And so I don't want you to see this broadcast and be very depressed because you have fibromyalgia. I want you to see this broadcast and say, oh my goodness, I did not know that my gut issues were at the root of the problem. Now, let me kind of explain a little bit more so you can understand. Each of your cells in your body, and you have 70 trillion. I don't think we really know exactly what we have, but we have around 70 trillion cells in the body. Each of those cells runs off of electrical voltage. How do you make electricity in your body? Water and minerals. Every cell in your body has 13 different tissue salts, and we talked about this a couple of programs ago. And we were talking about sea salt. We were talking about migraines. You can go back in the archives and look for that. But when you have the tissue salts and the water, you're going to be making voltage. Younger cells vibrate at a higher level, at a healthier level. Older cells naturally vibrate at a lower level. When you're vibrating at a lower level, then you are opportunistic for germs, viruses, fungus, chemical toxicities, heavy metal, parasites, whatever. So what we want to do is get your voltage up, because when your voltage is up, your cells are functioning normally. when you have an autoimmune disease, when you have fibromyalgia, when you have chronic fatigue syndrome, and there's really not a lot of difference between the two. They're both what they consider autoimmune issues. They both have to do with inflammation in the brain and the spinal cord. However, chronic fatigue syndrome has more encephalitic inflammation than the fibromyalgia. So just they're very, very similar, but there are some little differences there. So what we want to do is find out, do you have this? What is the label? How can you tell? And then what you can do about it, because we want to get you out of the pain cycle for sure. So there's two different kinds of fibromyalgia. There is primary fibromyalgia, and they call it idiopathic. That means we don't know what caused it. All right, we just don't know. So there's idiopathic tremors, there's idiopathic fibromyalgia, idiopathic anything, right, is we don't know what caused it. But then there's secondary fibromyalgia, which is caused from another diagnosable autoimmune disease, usually rheumatic, alkalizing spondylitis, lupus, IBS, trauma, and surgery. So we have people come in here, they were fine before they had surgery, and they're in constant pain since. So that is a dysfunction that people do have. It's a real thing. There are some doctors that believe that chronic pain is all in your head. They can't find any, source for it. There's no diagnostic test for it. You must be a hysterical woman. It must be nerves. I am not saying that. That is not what I'm saying. I'm saying they can't find a cause for it because it's in your gut. Once you get your gut and your brain reconnected, those things go away. Fibromyalgia is not life-threatening, but it definitely reduces your quality of life because you are in so much pain all the time. The problem with being in pain all the time is it sets up a negative feedback loop. You're in pain, so the body is trying to work that through, can't work it through, can't resolve the pain, so it just gets on this cycle, and just everything hurts, and then everything hurts more, and then more things hurt, and more things hurt more. And so it is a disease that progresses, and we don't want that to happen. So when you go to the doctor, they're going to ask you about pain. They're going to ask you about tender points. Now, tender points are also known as trigger points, are specific body sites where they would touch you and you would be in pain. It can be just as simple as a hug. And I know people, and I'm sure you know people, that when you hug them, and you're not giving them a bear hug, but you're giving them a very warm, heartfelt hug, and they go, oh, that really hurts. Okay, so that's what we're talking about. A hug should not hurt. When you have fibromyalgia, you can have as many as 18 different tender points. There's increased pain sensitivity. So that means that what should not hurt you does hurt you. There is intense responsiveness to sensory stimuli. That can be light, that can be scent, that can be temperature. So you want to make sure if you are overly sensitive to light, if you're overly sensitive to noise, then it could be a digestive thing. Could be something as common as brain fog. We have a lot of people that come in and they just can't stay focused because of brain fog and all that kind of thing. Sleep disorders. If you have sleep disorders, this is another symptom of people with fibromyalgia. They cannot go to sleep because they cannot lower the pain threshold. The pain keeps them up all night. When they're not getting their sleep, then they're getting more tired. When they're getting more tired, they're going to feel things more intensely. I mean, just think about your own experience. You stay up too late watching a movie. You don't get to sleep in the next day. You get up, you're tired. You're more irritable because you're tired. Well, take that to the next level. Your body is tired. Your body is already fighting these pain things. And so lack of sleep because of pain is just going to make you more and more irritable and more painful because you're not having that rest that you need. Extreme fatigue. Some individuals have extreme fatigue with constant tiredness, and then there are headaches. People get headaches with fibromyalgia. It can be migraine or it can be tension, and that is experienced by half of the fibromyalgia patients. Less common symptoms include tingling, burning, or prickling in the arms, painful menstrual cycles, digestive issues, IBS, constipation, and diarrhea. And I'm just going to tell you, IBS is the easiest thing to resolve in the whole world. I'm just telling you. We had a guy come in this week, and I started working with him about 4 months ago, and he had come in and he said that the doctor had told him that he had really bad diverticulitis. They needed to schedule surgery, remove certain sections of the colon, and then he would be okay because they would have taken out the part of the colon that was damaged and diseased. So he came in to see me. We put him on a repair protocol. He's lost quite a few pounds, and he went back to the doctor, and the colon is perfect. And he told me I could never retire because I saved his life, and he didn't have to have surgery, and he was forever grateful. So we appreciate that. I mean, that's what it's all about, is getting people the help that they need. But diverticulitis, irritable bowel syndrome, all that kind of thing, constipation, diarrhea, those are symptoms that there's something wrong with your nutrition. You're not absorbing your nutrition. Anxiety and depression. Now, we live in anxious times. I mean, we just do. Things are crazy. My husband went grocery shopping. Of course, it's Thanksgiving next week, and so he was going grocery shopping, and he came home and he was telling me how much money he spent, and he said, I bought a light bulb, one light bulb. And he said, guess how much the light bulb was? I have no idea. I haven't bought light bulbs in forever. He said it was $13. Now, $13 for a light bulb is a little bit extreme, but that just shows you what's going on with the economy. So you've got that stress, which leads to anxiety, and it leads to depression. Overactive bladder. Of course, we see on the television all these cute little commercials for people that have overactive bladder, but that is part of the symptoms of fibromyalgia. TMJ is part of that. Less endurance in exercise. So if you don't have a whole lot of endurance, everything tires you out too quickly, then that might be a symptom of fibromyalgia. Dry eyes. Now, dry eyes is also a symptom of Sjogren's disease, which is an autoimmune disease. Shortness of breath, difficulty swallowing, and then heart palpitations. Now, heart palpitations can be a thyroid dysfunction, it can be a cardiovascular dysfunction, or it can be an autoimmune dysfunction. So some people have heart palpitations as well. If you have fibromyalgia, then you can have what is called a flare. And a flare is, I'm doing fine, everything is good, 2 or 3 days, 2 or 3 weeks, whatever, and then all of a sudden everything is just intensified. Now, what causes that? Stress, times of stress. So this can be dealing with illness, dealing with other people that have illness, being a caretaker, because being a caretaker is very stressful, traveling, encountering changes in the weather. Now, you would think that the weather is out there, not in here, and as long as I stay at a constant temperature and not get myself soaked, I should not have any kind of issues. However, with fibromyalgia patients, they do feel extreme shifts in the weather. People with autoimmune conditions feel shifts in the weather. People with bone conditions, arthritis and different things, feel shifts in the weather. You might remember your grandmother talking about rheumatism, okay, or she's got the rheumatiz, depending on where in the country you grew up. Well, that's because the frequency of the weather, there's a different frequency with cold and hot, wet and dry. When that frequency, that barometric pressure changes the vibrational frequency, then it can affect you if you are not in tune with the Schumann wave. And so you might want to Google that and see what that means. If somebody experiences fluctuation in hormone levels or in medication, right, they can have a problem. Or if they encounter stressful situations. Now, as I said before, there are no clear biomarkers for fibromyalgia. It is a range of symptoms, and it is the intensity of the symptoms, and it is the length of symptoms. There is no blood work that you can do. There's no diagnostic imaging that you can do that tells you that you have fibromyalgia. What the doctor will do is he will do all these tests to rule out other things. We're going to rule out diabetes. We're going to rule out IBS. We're going to rule out autoimmune. We're going to rule out all these other things. We've got nothing to go on, therefore it must be fibromyalgia. And so, it's kind of a basket that they dump you into because they don't know where else you fit. I'm telling you, it fits in the digestive situation, all right? The World Health Organization says that fibromyalgia is a very real disease, and it is a chronic disorder. It is also perceived by global academia as non-imaginary. The Food and Drug Administration has approved several medications for the treatment of the condition depending on the type, so whether it's primary or secondary. When you have the pain, they're going to give you depression medicine, they're going to give you pain medicine, or they're going to give you anti-seizure medicine. Why? Because all three of those work on different pathways that can dumb down the pain, get the pain resolved. I'm just telling you, if you get your nutrition resolved, if you get that uptake of nutrients the way it needs to be, then you're going to have a big difference in your body. So a person with fibromyalgia is very hypersensitive to pain. That can be a reason or a outcome of your family genetics. So if your mom had fibromyalgia, you might have fibromyalgia. It can come down through the generations. Now, I don't think it's really an inherited gene issue. I think it is an inherited viral load. Now, why do I say that? Because fibromyalgia is a nerve pain, sickness, and disease. Everything is painful. It's not like an ache, like you work out and your muscles ache. They're not painful, but they ache. This is more of a nerve sensation, and when you have a high viral load in the body, the viruses burn off the myelin sheath on your nerves, and so you are more sensitive to pain. So let me kind of back up a little bit and bring you up to speed with what I'm trying to tell you. In the northern hemisphere, all right, that is Canada, the United States, and Mexico, 95% of adults have the Epstein-Barr virus. The Epstein-Barr virus is responsible for Epstein-Barr, of course. It's also responsible for mono. How many of us had mono as teenagers? Yeah. How many of us get a flare with mono when we get, sick and stressed? Yeah, people do. Also, on the other end of the spectrum, because mono is not that big of a deal. I mean, you're tired and you're lethargic and you want it to be over with, and I agree with that. But, on the other end of the spectrum is Guillain-Barré syndrome, which is an absolute killer disease. But it's the same virus that causes both of them. We inherit viruses because they are in the DNA. So if mama had fibromyalgia, if grandma had fibromyalgia, the viral load is in the DNA and it comes right down through the generations. Now, can we do that? Can we resolve that? Of course we can. We do it through nutrition. We do it through frequencies. We do it through a lot of things. And what does that mean to you? That means that your body raises its vibrational frequency where those viruses are not able to manifest. Are we ever able to get you virus-free? No. It's part of your DNA. It's part of your microbiome. But that's why when you're under stress, you break out. When you're under stress, you get sick. When you're under stress, you feel worse because stress lowers your immunity. And your immunity is from the food that you get that turns into antioxidants. So this is my trusty little Pharmanex scanner. We've got our laser right here. And what that does is you look at the heel of your hand, look at it. You put the laser on it, and the laser reads how much of your nutrition are you absorbing, and your body is able to turn into antioxidants, because it is the antioxidants that keep the viral load down. It is the antioxidants that stop the internal aging. It's the antioxidants that prevent the free radical damage. And so that's something that we need to know. Inflammation being high, immunity being low. So if you're one of these people, and we see these every week, if you're one of these people that comes in, I had a lady sitting in my office today, and she said, I catch every flu that comes around. I catch everything that comes around. She said, I just catch it. Well, what that's telling me is your gut is not right. Your immune system is not strong. You don't have enough antioxidants. So I like to explain it like this. For those of us that are older, or maybe you're just a sci-fi buff, you remember Star Trek, maybe Star Trek on the TV show. Star Trek, the Enterprise would be gliding through outer space, and all of a sudden somebody would call the captain and say, so-and-so is coming to get us, and the captain would go, put your shields up. So they would put their shield up, and whatever kind of missiles that were coming would just bounce off the shield, right? That's what your immune system is that shield. So for me, for my husband and I, we do a lot for our immune system because we're older and we're in a high traffic environment. We have people come in all the time that are sick and that kind of thing, and we don't want to get that. So we supplement appropriately so that our immune shield is always up. And so when those viruses come, when the bacteria come, when the parasites come, the shield, the antioxidants are so high they can't get a foothold. Our vibrational frequencies are so high we can't get a foothold. And so that's what we want for you as well. And so when your inflammation is high and your immunity is low, then you're going to have problems with fibromyalgia. And of course, there are the environmental factors, which is all the toxicity that we have in the environment. You are smelling the smells that you smell. You're wearing clothing that has synthetic fibers in it. Your carpet is off-gassing the formaldehyde. You're eating foods that are not foods. You're eating foods that have different chemicals in them that are not healthy, particularly bread or pasta. Now, why is that? Because here in the United States, our grain is sprayed twice with Roundup. Roundup has glyphosate in it. Glyphosate gives us gut issues. So we don't want to have that. If you have secondary fibromyalgia, you could have systemic lupus. You could have osteoarthritis. You could have depression, anxiety, chronic back pain, and IBS. And so, they all go together. In some cases, the fibromyalgia comes first, idiopathic, and we've got the extra symptoms. In other cases, we have the other symptoms first, and then it morphed into fibromyalgia. So this disease normally targets women, normally between the age of 35 and 45. If you have a history of depression and anxiety, you are more prone to this. If you have a family history, you are more prone to this. If you are obese, you have a greater potential to have this. If you have had repetitive injuries, so say you do some kind of manual labor work and you're hurting your arm, and then you hurt your arm, and then you hurt your arm, and you hurt your arm, that's a repetitive injury, and so that can be a problem. If you're a tennis player or if you're a baseball player and you hurt yourself and hurt, with the swinging and all that kind of thing, so that is a repetitive injury. People who smoke are more liable to get fibromyalgia. People that have brain and spinal cord trauma. Now, this is physical trauma. You've had a concussion, you've fallen, you've had an accident, whatever, but also PTSD. PTSD is a real thing, and it can predispose you to more of the chronic pain issue, recent illness or disease, and then also substance abuse. So if you have all those kind of things, then you could have fibromyalgia. Now, how do we rule it out? Well, we do the real blood work. We do the CBC, we do the metabolic panel, we do the thyroid panel, we do the vitamin D, we do the differential, and we rule out all the other diseases. And if everything is good here, then we know it's fibromyalgia. Now, I differ a little bit in the from the medical people. They're looking at their reference range, and if you're out of that reference range, then you're into sickness and disease. I'm looking at the reference range, and I'm looking for optimal values. And if you're not in optimum, which hardly anybody is, it's our goal to get you there, and we do a really good job. But if you're not in optimal values, then you're headed toward sickness and disease, and we do not want to see that. Now, if you do have if you have fibromyalgia, you could have complications, reduced quality of life, frequent hospital stays, higher incidence of suicide and injury-related death, a higher prevalence of other rheumatic conditions. So the treatment are basically lifestyle changes. Well, surprise, surprise, surprise. What that means is you have to change your diet, and you have to get your gut and your brain reconnected. So that's the number one thing that we do. The other thing that we recommend that you do is you do diet and exercise, exercise and fitness, so that you're able to get your body moving the way your body wants to do that. And that can be muscle strength, that can be flexibility, that can be yoga, general exercises. We're not asking you to go out and do a marathon or anything like that, but just the simple act of walking is going to get you in a different position with your muscles. So getting sufficient sleep is something that we need. Managing stress is something that we need. And all of these are life skills. Identifying and avoiding triggers. So you know what makes you hurt, and so you avoid that. Relieving pain and stiffness. So this can happen with medication, this can happen with exercise, this can happen with cold packs, and this can happen with massage. Monitoring your mental state. The longer you deal with anxiety disorder and depression, the higher your incidence of fibromyalgia is going to be. And so we want to make sure that when we do experience anxiety, and we all do from time to time, we don't want it to be a lifestyle. We all go through stressful situations. We all go through things that we wish were different. However, we don't want it to be continual day by day by day. Avoiding smoking. Smoking increases the cognitive dysfunction and increased symptom sensitivity. All right, adjusting your work demand is another thing. So the medicines I already told you about, muscle relaxants, anticonvulsants, pain relievers, and antidepressants. Had to look at my notes there. And those are the things that you can do, but holistically, you can do something called transcranial direct current stimulation, which is a brain stimulation technique to resolve the inflammation in the brain. We have a guy here in the clinic that does something similar. He doesn't use any kind of tools, but he is very educated in removing the inflammation from the brain. We want to make sure that chiropractic, making sure that your spine and your neck are aligned, because if they're not aligned, what you're going to have is inflammation there. According to the National Fibromyalgia Association, having a positive mindset or attitude is very important, since many studies indicate that a positive attitude has a notable physiological impact. Pessimism is associated with poorer health, while optimism correlates with faster recovery with illness. One study revealed that among the general population, the most optimistic individuals had an average lifespan of 11 to 15% longer, and they had significantly higher chances of reaching the age of 85 as compared to the least optimistic group. Fibromyalgia will not be cured by a positive outlook, but a positive outlook will reduce these symptoms. There's also acupuncture. I don't know if you've tried acupuncture. Don't be afraid of the needles. They are about the width of a hair. I've done it. They're a width of the hair. They poke them in. You never feel it, but what you feel is the energy, and you feel pain reduction and that kind of thing. So I would definitely recommend acupuncture. And then supplements. So we want to look at different supplements. So there's omega-3 fatty acids. It is renowned for reducing inflammation in the brain. When we have our ADD kids, ADHD kids, we put them on a lot of omega-3s, and it just reduces that hyperactivity because it reduces the inflammation in the brain. Vitamin D. Studies have found that vitamin D supplements in fibromyalgia patients result in pain reduction. Acetyl L-carnitine is a modified version of the amino acid carnitine. It plays a role in energy production in the body, and initial findings in a study indicate that it is effective in reducing the symptoms of fibromyalgia. Magnesium. Magnesium is connected to muscle relaxation, muscle movement, and the studies have shown that people with fibromyalgia are deficient in magnesium. SAMe also is an amino acid, and people with fibromyalgia are deficient in that. So where do you get your amino acids? You get your amino acids through your proteins, particularly your animal protein. So it may be, and I don't know this, and the report doesn't tell us this, But it may be that vegetarians and vegans have a higher incidence of this because they do not do animal proteins. CoQ10 and melatonin are also nutrients that help with fibromyalgia. Now, on the herb side, there's ginger. Ginger has active compounds that relieve inflammatory processes. Ginseng also relieves pain. Turmeric also removes pain or lessens pain, but you want to work with, I only know of 2 turmerics that work, and they're both processed with pepper, a black pepper. Turmeric is not easy bioavailability. If you use it like they do in India, you use it on your food 24/7, all of their foods have turmeric in it. They're getting a lot because they're getting constant supply. If you're like me and you just take a supplement, if the supplement does not have that black pepper combination in it, it's not going to be bioavailable, and you're not going to get much help with that. Capsicum. Now, capsicum is what makes your red peppers, your jalapeno peppers, all that kind of thing, your chili peppers. That's what makes that hot. So it is the spicy hot from the pepper. It is a pain reliever, and it is found in creams and liquids and different things like that. So we've talked about all of that. How do we prevent fibromyalgia? Well, number one, we eat a balanced whole foods diet. All right, we get our gut and our brain connected. We get adequate sleep. We avoid overexertion. We maintain our emotional well-being. We have regular exercise, and we have good stress management. So there is quite a lot that you can do. If you have fibromyalgia, then you can look at these tips and you can, do some self-help and see where you go. If you need help connecting the gut to the brain and getting those antioxidants doing what they need to do so you've got that shield up, then come and see us and we're able to help you and to give you the relief that you need. Now, does that mean we cure fibromyalgia? No, that's not what we do. What we do is we restore your body to health so your body is not subject to the things that cause fibromyalgia. So there's a big, big difference, all right? People think they go to the medical doctor gives them drugs, the drugs heal them. That's not how it works. The drugs turn off the symptom. That's how that works. When you see a holistic practitioner, they're going to go to the root of the system, which is normally your gut-brain connection, resolve that problem, and then the body just takes over and the body gets well because it's a survival organism, and that's what it wants to do. And so thank you for liking. Thank you for sharing. Thank you for commenting. All those kind of good things. We appreciate that. It is Thanksgiving week next week, so we will not be having a program next week because we're closed Thursday and Friday, and I hope your office is closed Thursday and Friday too, because we have so much to be thankful for, even though there's a lot of stress and a lot of anxiety and $13 light bulbs and all that kind of thing. However, we have quite a bit to be thankful for. Be thankful for your health. Be thankful for education. Be thankful for all the things that we have, your family, all the things. And a positive mindset, remember, helps our body to stay healthier longer. So I'm going to leave you with that thought. Enjoy your Thanksgiving, and I will see you in 2 weeks. Thank you so much.